In this video, I would like to show the progress of a patient with a central nervous system disorder who underwent stem cell therapy 3 times and how their condition changed throughout the treatment. I'm not trying to say in this video that stem cells are great or amazing or to deliver that kind of message. As I explained to the patient, despite undergoing numerous tests, no diagnosis could be made, and there were no available treatments. It was a hopeless situation where it felt like all that was left was to leave it up to fate. In such a case, we decided to use the patient's own cells and the exosomes, which are the effective components secreted by those cells, to see if they could help with this neurological disorder. Since there have been people who actually benefited from this approach, I explained it to the patient and proceeded with the treatment. We plan to conduct an interview about this process. The main symptoms for this patient were paralysis, stiffness, and rigidity in the legs, making it difficult to walk. However, it wasn't Parkinson's disease, ALS, or any genetic disorder. No cause could be identified. But whether it's Parkinson's, cerebellar atrophy, ALS, Parkinson's syndrome, multiple system atrophy, or any degenerative neurological disease, when patients deteriorate rapidly, they tend to fall easily while walking. Because it's hard to maintain balance, many patients with osteoporosis end up falling, and if they fracture a leg bone, hip, or ankle, these kinds of fractures not only heal poorly, but having to stay bedridden because of the fracture causes their overall condition to deteriorate even further. In such a deteriorating condition, they end up being hospitalized due to trauma. From the hospital, they are transferred to a long-term care facility. In many cases, people end up spending their final days there, so being able to walk independently, maintaining the ability to walk without falling, and having sufficient leg strength are extremely important for health in old age. Of course, this doesn't only apply to people with central nervous system diseases. Even among the general population, as people age, their muscle strength weakens. So in cases where there is a sudden decline, people may fall while walking, get injured, and regardless of the underlying disease, trauma or fractures can further worsen their condition or lower their quality of life. That's why walking is such an important aspect, and one of the reasons for treatment, just like in this case, is that when someone is gradually deteriorating and then suddenly worsens, if we just observe without treatment, the decline will continue. It's rare for things to improve on their own. So by treating, we aim to stop the rapid decline and, if possible, even bring the patient back to the stage just before the rapid deterioration. That in itself could be meaningful. No one can guarantee or say for sure how long that improvement will last. But still, with the goal of returning the patient to a state before things got worse, we proceeded with treatment. So, of course, even before this patient, there have been cases where treatment led to positive results and cases where it did not. Not every patient improves, but still, about 3 or 4 out of 10 patients experience some change. The degree of change also varies, but it is still meaningful. Because of these various experiences, I made sure to fully explain everything to the patient before proceeding with treatment. So, after administering stem cell and exosome injections through the spinal canal, some relatively rapid changes appeared. Of course, these changes can't be confirmed through objective tests, but based on the patient's own words and by observing their walking, you can get a sense of it. We can't know exactly how much improvement there will be or how long it will last, but I thought it would be good to share with you what kinds of changes are happening and how things are progressing, so that's why I'm filming this video. Today was the 3rd session, and honestly, I'm curious, as I'm sure you are, about how this person will change in 3 or 6 months. If there's an opportunity in the future, it would be great for us to check in together and see how they're doing after 3 months, 6 months, or even a year.
At first, my left leg was a bit weak, so, for example, when I tried to carry things, my left leg didn't have enough strength, which made it uncomfortable to step over curbs and things like that. Initially, it was just a little bit, but then it gradually got worse. I tried doing some underground exercises and even learned different kinds of dances, but as time went on, the discomfort kept increasing. So then, after getting an MRI, they said it was lumbar spinal stenosis. So I had nerve block procedures 3 times. It seemed to get a little better, but then it went right back to being not much different. After that, I thought this wouldn't do, so I went to the neurology department at Seoul National University Hospital. So I got a referral letter. After being hospitalized for about a week and getting all the MRIs and spinal cord tests done, they couldn't find any explanation. In other words, they didn't know what the cause was. The professor there told me to get rehabilitation therapy at a nearby place or to try learning to dance. So I tried, but it didn't really get any better. For several years, I kept doing rehab exercises at Bundang Hospital, but my back still felt stiff and my legs were uncomfortable. So I went to a neurosurgery clinic in Gangnam thinking maybe there was something wrong with my back again. After getting another MRI, the director said I needed to get checked again. They did every possible test on my brain and then said it was a muscle disease. So they just prescribed vitamin D and magnesium and told me that my condition would continue to progress in the future. There was no medication for treatment, so I just kept taking all sorts of supplements, but it didn't help. Later on, I went to Aju University Hospital to see a neurologist there. When I went to the renowned professor there, he said, "We'll do some tests later, okay?" I showed him all my MRIs and he did some close examinations and then ran several more tests. But even there, they couldn't come up with a diagnosis. They said it's because the nerve cells are gradually dying. There is no treatment available overall. So they prescribed baclofen, a muscle relaxant, and I took it. It seemed to make my muscles a bit softer, but the disease kept progressing nonetheless. Even though I kept doing rehabilitation exercises and tried everything, the disease kept progressing. Still, I continued with the rehab exercises, walked barefoot, and even gained some strength in my bare feet, but the disease kept getting worse, and walking became more and more difficult. While I was continuing with the rehab, I saw a lot of ads about stem cells on YouTube, so I thought I'd try getting that treatment as I mentioned earlier. So I called them, and as soon as I got there, without any explanation, they just drew my blood, centrifuged it, and immediately injected it into my knee. I didn't even get to talk to the director or have any kind of conversation. That's just how they do things there. They said that's the way it has to be. So later on, I realized that place wasn't good. But at first I was just ready to pay over 7 million won because I was desperate to get my knee fixed. Right now it's hard for you to even get around. I saw on YouTube there's this place, Osang Neurosurgery Clinic. Since Director Omio himself was speaking, I felt I could trust him. He said this isn't some miracle cure for 10,000 people. You shouldn't get your hopes up too much. And honestly, you have to keep talking about it. If you expect too much, you'll end up really disappointed. So while watching YouTube, I decided to call this place because they said they treat with stem cells. They said they do. So I thought, let's give it a try. I went there and got treated on July 2nd, then again on August 25th, and today is my third time. The director said that out of 3 people, 1 gets better. Even if it's 1 out of 3 or even 1 out of 100, I still want to try it. If 3 out of 10 people get better, that's actually pretty good odds. Because it's 3 out of 10 people. That's the mindset I had when I received the treatment. I did have some expectations, but you shouldn't expect too much from the director. Because if you have high expectations and things don't improve much, you end up really disappointed. It's not like there's a cure or anything. There isn't one anywhere in the world. Since there's no cure anyway, I just thought, well, it is what it is. As I gradually got better, I started doing rehabilitation as well. Honestly, neither I nor the patient really know exactly why. Because some days my legs feel light and move well, and other days they feel heavy and don't move as easily. But after the second treatment, my legs started moving much better. I stopped freezing up as much, and my condition kept improving. Now that I'm on my third treatment, I expect it'll get even better. When I go for walks outside, there's a janitor there who told me, "Boss, you've really improved a lot." When I first came here, I just wished I could push this walker more comfortably. Now, I can push the walker around with ease, even during the day. That's something, right? It feels comfortable. When I'm out with the walker and I need to pass by people, I used to have trouble because my feet wouldn't lift and it was hard to grab the walker again. But now it's much easier and I can move around. Since I'm steadily getting better, if this continues, I think I'll be able to walk on my own.
Are you his daughter? How do you feel? Do you think he's getting a little better?
Since there was some effect, even though the stem cell treatment isn't commercialized yet and I was worried, there was no other option. And since he said he wanted to get it, I didn't try to stop him, so I thought, even if it's just a placebo effect, if he improves even 10%, that would be fortunate, even if it's a scam. But compared to that, I think he's actually gotten a lot better. Today was his third injection, and after the second one, I thought he would get even better.
These days, I don't even mention feeling uncomfortable anymore.
If you had a patient or an individual seeking care like yourself in front of you before, as a medical professional, what would you say to them?
I got GCF treatment here and it made me feel this much better. Since that person isn't uncomfortable, please introduce them to this place. go and meet the director and have a consultation. First, don't start treatment right away. Go and have a consultation, and if you feel comfortable, then proceed. Talk about it. Go and see for yourself. There are people who don't get treatment even though they have the money, because they don't want to spend the money. It's not like you're going to die with that money anyway. And there are people who can't get treatment even though they have the money, simply because they don't know about it, because they don't know. If you get treatment and even feel a little better, isn't that a good thing? If you feel even a little bit better, your mood really improves. You only know after you actually try the treatment. Just hearing about it isn't enough. You have to experience it yourself to know. They say you can see improvement for about 3 to 6 months. So, if you take good care of yourself, it can last for 10 years or more. So, while you're getting this treatment, you really have to manage yourself well. If I get a lot better, then other patients like me should come and get treated too, right? And if you get better, you might need to get the treatment once or twice a year. If you get better, then the next time you come, if you're completely healed, you should still come back. That way we can really see that you've improved. You should come back, say hello, and then leave.